Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
A prima gravida client admitted to the labor area in early labor tells a nurse that her brother was born with cystic fibrosis, and she wonders if her baby will also have the disease. The nurse can tell the client that cystic fibrosis is 1. X-linked recessive, and the disease will only occur if the baby is a boy. 2. X-linked dominant, and there is no likelihood of the baby having cystic fibrosis. 3. Autosomal recessive, and that unless the baby's father has the gene, the baby will not have the disease. 4. Autosomal dominant, and there is a 50% chance of the baby having the disease. The correct answer is 3. Cystic fibrosis and other inborn errors of metabolism are inherited as autosomal recessive traits. Such diseases do not occur unless there are 2 genes for the disease present. If one of the parents does not have the gene, the child will not have the disease. X-linked recessive genes can result in hemophilia A or color blindness. X-linked recessive genes are present only on the X chromosome and are typically manifested in the male child. X-linked dominant genes, which are located on and transmitted only by the female sex chromosome, can result in hypophosphatemia, an inborn error of metabolism marked by abnormally low serum alkaline phosphatase activity and excretion of phosphorethynolamine in the urine. This disorder is manifested as rickets in infants and children. Autosomal dominant gene disorders can result in muscular dystrophy, Marfan syndrome, and osteogenesis imperfecta. Typically, a dominant gene for the disease trait is present along with a corresponding healthy recessive gene. A woman who is Rh negative has given birth to an Rh positive infant. The nurse explains to the client that she will receive Rogum. The nurse determines that the client understands the purpose of Rogum when she states, 1. Rogum will protect my next baby if it is Rh negative. 2. Rogum will prevent antibody formation in my blood. 3. Rogum will be given to prevent German measles. 4. Rogum will be used to prevent bleeding in my newborn. The correct answer is 2. Rogum is given to new mothers who are Rh negative and not previously sensitized and who have given birth to an Rh positive infant. Rogum must be given within 72 hours of the birth of the infant because antibody formation begins at that time. The vaccine is used only when a mother has born an Rh positive infant, not an Rh negative infant. Rogum does not prevent German measles and is not given to a newborn. What is the most appropriate method to use when drawing blood from a child with hemophilia? 1. Use finger punctures for lab draws. 2. Prepare to administer platelets. 3. Apply heat to the extremity before venipunctures. 4. Schedule all labs to be drawn at one time. The correct answer is 4. Coordinating labs to minimize sticks reduces trauma and the risk of bleeding. Finger sticks in general are more painful and associated with more bleeding than venipunctures. In hemophilia, platelets are typically normal. Heat would increase vasodilation and increase bleeding. The primary healthcare provider has prescribed prostaglandin gel to be administered vaginally to a newly admitted prima gravida client. Which of the following indicate that the client has had a therapeutic response to medication? 1. Resting period of 2 minutes between contractions. 2. Normal patellar and elbow reflexes for the past 2 hours. 3. Softening of the cervix and beginning of effacement. 4. Leaking of clear amniotic fluid in small amounts. The correct answer is 3. Prostaglandin gel may be used for cervical ripening before the induction of labor with oxytocin. It is usually administered by catheter or suppository or by vaginal insertion. 2 to 3 doses are usually needed to begin the softening process. Common adverse effects include nausea, vomiting, fever, and diarrhea. Continuous fetal heart rate monitoring and close monitoring of maternal vital signs are necessary to detect subtle changes or adverse effects. Prostaglandin gel usually does not initiate contractions. Therefore, the rest period between contractions will be greater than 2 minutes. There is no need to assess reflexes based on prostaglandin use. Leaking of amniotic fluid is not caused by the use of this gel. A 38-year-old client at about 14 weeks gestation is admitted to the hospital with a diagnosis of complete hydatidiform mole. Soon after admission, the nurse would assess the client for signs and symptoms of which of the following? 1. Pregnancy-induced hypertension. 2. Gestational diabetes. 3. Hypothyroidism. 4. Polycythemia. The correct answer is 1. Hydatidiform mole is suspected when the following are present: pregnancy-induced hypertension before the 24th week of gestation, brownish or prune-colored vaginal bleeding, anemia, absence of fetal heart tones, passage of hydropic vessels, uterine enlargement greater than expected for gestational age, and increased human chorionic gonadotropin levels. Gestational diabetes is related to an increased risk of preeclampsia and urinary tract infections, but it is not associated with hydatidiform mole. Hypothyroidism, not hypothyroidism, occurs occasionally with hydatidiform mole. If it does occur, it can be a serious complication, possibly life-threatening to the mother and fetus from cardiac problems. Polycythemia is not associated with hydatidiform mole. Rather, anemia from blood loss is associated with molar pregnancies. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which of the following behaviors exhibited by the parents of an infant with pyloric stenosis should the nurse correctly interpret as a positive indication of parental coping? 1. Telling the nurse that they have to get away for a while. 2. Discussing the infant's care realistically. 3. Repeatedly asking if their child is normal. 4. Exhibiting fear that they will disturb the infant. The correct answer is 2. The parent's ability to verbalize the infant's care realistically indicates that they are working through their fears and concerns. This behavior demonstrates an understanding of the infant's condition and needs. Without further data, the fact that the parents have to get away could be interpreted as ineffective coping, possibly suggesting that they are unable to handle the situation. Continuing to ask about the child's general condition even after answers have been given does not suggest effective coping. The parents are demonstrating that they are unsure themselves as parents or are hoping for positive information. Exhibiting fear that they will disturb the infant does not suggest effective coping. This behavior indicates that they are uncertain or lack knowledge about infants. After teaching the mother of an infant with pyloric stenosis about the disease, which of the following is stated by the mother as a cause, indicates effective teaching? 1. An enlarged muscle below the stomach sphincter. 2. A telescoping of the large bowel into the smaller bowel. 3. The result of giving the baby more formula than is necessary. 4. The result of my baby taking the formula too quickly. The correct answer is 1. Pyloric stenosis involves hypertrophy of the pylorus muscle distal to the stomach and obstruction of the gastric outlet, resulting in vomiting, metabolic acidosis, and dehydration. Telescoping of the bowel is called intussusception. Overfeeding, feeding too quickly, or underfeeding is not associated with pyloric stenosis. When the infant returns to the unit after imperforate anus repair, the nurse should place the infant in which of the following positions? 1. On the abdomen, with legs pulled up on the body. 2. On the back, with legs extended straight out. 3. Lying on the side with the hips elevated. 4. Lying on the back in a position of comfort. The correct answer is 3. After surgical repair for an imperforate anus, the infant should be positioned either supine with the legs suspended at a 90-degree angle or on either side with the hips elevated to prevent pressure on the perineum. A neonate who is placed on the abdomen pulls the legs up under the body, which puts tension on the perineum, as does positioning the neonate on the back with the legs extended straight out. After surgery to repair a tracheoesophageal fistula, an infant receives gastrostomy tube feedings. After feeding the infant by this method, the nurse cradles and rocks the infant for about 15 minutes, primarily to help accomplish which of the following? 1. Promote intestinal peristalsis. 2. Prevent regurgitation of formula. 3. Relieve pressure on the surgical site. 4. Associate eating with a pleasurable experience. The correct answer is 4. The nurse can help meet the psychological needs of an infant being fed through a gastrostomy tube by rocking the infant after feeding. The infant soon learns to associate eating with a pleasurable experience and learns to trust the caregiver. Rocking the infant will not promote peristalsis or prevent regurgitation. Holding the baby will not relieve pressure on the surgical site. However, holding the child right after feeding promotes comfort and pleasure. The parents report that their 1-day-old is drooling and having choking episodes with excessive amounts of mucus and color changes, especially during feedings. The nurse should contact the primary care provider to further assess the baby and request a prescription for 1. A lactation consultation. 2. A blood gas. 3. An X-ray with orogastric catheter placement. 4. A serum blood glucose. The correct answer is 3. The drooling and excessive mucus production is highly suggestive of a tracheoesophageal fistula. The initial diagnosis is made when an orogastric catheter cannot be passed to the stomach. A lactation consult would be warranted only after determining feedings were safe to continue. While cyanosis can be a sign of sepsis and hypoglycemia, the cyanosis is most likely related to the excessive secretions and airway patency. A blood gas may be needed, but only after ruling out a TEF. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. While making rounds, the nurse finds a client with COPD sitting in a wheelchair, slumped over a lunch tray. After determining the client is unresponsive and calling for help, the nurse's first action should be to 1. Push the emergency response button. 2. Call the rapid response team. 3. Open the client's airway. 4. Call for a defibrillator. The correct answer is 3. The nurse has already called for help and established unresponsiveness, so the first action is to open the client's airway. Opening the airway may result in spontaneous breathing and will help the nurse determine whether or not further intervention is required. Pushing the code blue button may not be the appropriate action if the client is breathing and becomes responsive once the airway is open. A quick assessment upon opening the client's airway will help the nurse to determine if the rapid response team is needed. Calling for a defibrillator may not be necessary nor the appropriate action once the client's airway has been opened. A client has developed a hospital-acquired pneumonia. When preparing to administer cephalexin 500 milligrams, the nurse notices that the pharmacy sent cefazolin. What should the nurse do? Select all that apply. 1. Administer the cefazolin. 2. Verify the medication prescription as written by the physician. 3. Contact the pharmacy and speak to a pharmacist. 4. Request that cephalexin be sent promptly. 5. Return the cefazolin to the pharmacy. The correct answers are 2, 3, 4, and 5. One of the rights of drug administration is right medication. Cefazolin was not the medication prescribed. The pharmacist is a professional resource and serves as a check to ensure that clients receive the right medication. Returning unwanted medications to the pharmacy will decrease the opportunity for a medication error by the nurse who follows the current nurse. Which of the following complications is associated with mechanical ventilation? 1. Gastrointestinal hemorrhage. 2. Immunosuppression. 3. Increased cardiac output. 4. Pulmonary emboli. The correct answer is 1. Gastrointestinal hemorrhage occurs in about 25% of clients receiving prolonged mechanical ventilation because of the development of stress ulcers. Clients who are receiving steroid therapy and those with a previous history of ulcers are most likely to be at risk. Other possible complications include incorrect ventilation, oxygen toxicity, fluid imbalance, decreased cardiac output, pneumothorax infection, and atelectasis. A client has the following arterial blood gas values: pH 7.52, PaO 250, PaCO 228, HCO 324. The nurse determines that which of the following is a possible cause for these findings. 1. Chronic obstructive pulmonary disease. 2. Diabetic ketoacidosis with Kussmaul's respirations. 3. Myocardial infarction. 4. Pulmonary embolus. The correct answer is 4. PaCO2 of 28 and PaO2 of 50 are both abnormal. The PaO2 of 50 signifies acute respiratory failure. In evaluating possible causes for this disorder, the nurse should consider conditions that lead to hypoxia and hyperventilation, such as pulmonary embolus. COPD is typically associated with respiratory acidosis and elevated PaCO2. The client with diabetic ketoacidosis most often has metabolic acidosis. A myocardial infarction does not often cause an acid-base imbalance because the primary problem is cardiac in origin. The nurse interprets which of the following as an early sign of acute respiratory distress syndrome in a client at risk? 1. Elevated carbon dioxide level. 2. Hypoxia not responsive to oxygen therapy. 3. Metabolic acidosis. 4. Severe unexplained electrolyte imbalance. The correct answer is 2. A hallmark of early ARDS is refractory hypoxemia. The client's PaO2 level continues to fall despite higher concentrations of administered oxygen. Elevated carbon dioxide and metabolic acidosis occur late in the disorder. Severe electrolyte imbalances are not indicators of ARDS. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.